Health Canada continues to tout the safety and efficacy of novel mRNA shots for everyone aged 6 months of age and up, including the novel boosters that are allegedly built on the safety of the shots before them. Yet they cannot provide the basic risk versus benefit calculation used to justify that the supposed or purported benefits outweigh the apparently deadly risks. Tamara Ugolini here with Rebel News to show you that while Public Health Ontario has reported a COVID-19 vaccine adverse events incident rate of 0.06%, as reported by the Globe and Mail, that is being cited as affirmative evidence that the COVID-19 vaccines are overwhelmingly safe. Even though they refer to this as fresh evidence, it's not fresh at all, since most adverse events have substantially fizzled out by January of 2023, surprisingly around the same time that booster uptake dropped substantially. And we know that adverse events are massively underreported, as confirmed by Senior Health Canada official Dr. Celia Lourenco. She was responsible for authorizing these novel injections. And according to the United States Agency for Healthcare Research and Quality, an official website of the Department of Health and Human Services, less than 1% of vaccine adverse events are ever reported. So surely Health Canada conducted a risk versus benefit analysis to back up the claim that these vaccines are safe and effective, right? Well, I have been searching for that basic risk versus benefit analysis since the early spring of 2021, when Health Canada first moved to authorize the novel mRNA injections for adolescents aged 17 and under. Before I show you the email communication I had with Health Canada, let's run through some of the historical context around some of this. See, in May of 2021, I first interviewed emergency room physician Dr. Marc Benoit, who at the time had been requesting the quantitative risk versus benefit analysis from Health Canada's radiopharmaceutical division that was used to justify the authorization of this novel product for youth. They claimed at the time that it was necessary to expedite the authorization of drugs and vaccines for COVID. But based on what? Surely there was an assessment conducted. After all, that is quite literally the cornerstone of informed consent, to adequately and accurately weigh the risk versus the benefit to make an informed choice. In response to Dr. Benoit, the BRDD, that's the Biologic and Radiopharmaceutical Drug Directorate Division of Health Canada, told him that feelings, not facts, were driving this decision. Look at this. Health Canada's review of COVID-19 vaccines and therapeutic products is based on a qualitative risk-benefit calculation. They say that it would not be sufficiently accurate to quantitatively calculate risk-benefit on our limited understanding of the virus and disease. But at that same time, the CDC knew that the risk of complications for children was higher for the flu than for COVID-19. That messaging coincidentally changed in June of 2021, just as the push to vaccinate children aged 5 and up was coming down the pike through superhero social media ads and fear-mongering video campaigns.
Mom, can I go outside and play with my friends?
No, honey, there's still something going around.
Okay.
When can we see her? We would love to see her. Squeeze those cheeks. Look over here. Look over here. Oh, cutie.
At the same time, I also filed an Access to Information request asking Health Canada for the risk analysis calculation, that calculation that was used to justify this decision. But after going back and forth for weeks on what exactly the ask was, Health Canada tried to bury me with 200,000 pages of documents. And then, in September of 2021, Health Canada took a 365-day extension. That's a year for that basic ask, and they've been silent ever since. In this report, I once again reached out to the media contact for Health Canada with the following inquiry. As more information comes to light about the SV40 promoter and impurities being present in both Pfizer and Moderna's COVID-19 vaccine vials, I would like to clarify Health Canada's continued risk analysis assertion. Number 1, what benefit do the mRNA vaccines offer Canadians? 2. What risk comes with the mRNA vaccines? And 3. What is the quantitative risk-benefit calculation that justifies continued market authorization, either in totality and or specifically for those under the age of 18? Health Canada responded at length about how the novel injections continue to meet stringent regulatory safety, efficacy, and quality requirements, but is very specifically in response to the recently discovered presence of that SV40 promoter, something that was not the basis of my questions at all. Before, of course, they confirmed that Health Canada continues to monitor the COVID-19 vaccines to ensure that they continue to meet the highest standards for safety, effectiveness, and quality, and that their benefits continue to outweigh any potential risks. But what is the benefit? And what are the potential risks? And do those benefits outweigh the potential risk? I responded to Anna Madison, that's the Senior Media Relations Advisor, asking just that. I reiterated that this should be a calculation using numbers, not words, and that the data used to justify the risk versus benefit calculation must be publicly available and verifiable before I politely asked them to please send this information. Anna sent me some links where Health Canada continually repeats the mantra that the benefits must also outweigh any risks. And the same for Moderna's authorization that the benefits must outweigh the risks. But what are the risks and what are the benefits? So in my third email, I asked Anna to confirm that Health Canada has not conducted a risk versus benefit analysis. She, at that point, stopped responding to me altogether. And that access to information request, the ATIP, remains outstanding over 2 years later. So if these shots are so safe and effective, then what's the holdup on releasing the risk-benefit analysis that was used to ensure their benefits do in fact outweigh their risks? Health Canada's inability to provide this basic risk versus benefit calculation, the same one that should have been used to justify and authorize the novel mRNA shots, coupled with their admission that feelings rather than facts drove their original decision, highlights a glaring lack of transparency and competence in ensuring the safety of Canadians. For Rebel News, I'm Tamara Ugolini. These kinds of discrepancies are exactly why we have launched an email blast campaign and petition at nomoreshots.ca. If you would like to send an email to Minister of Health Mark Holland to let him know that you would like to see these injections revoked from the market and have their emergency use authorization pulled, please head over to that website, nomoreshots.ca, sign our petition, and send an email to Minister Holland letting him know where you stand. Thanks for your support.